Okay, that leads us nicely into recommendations for over 40. So there's a few of these questions came through around the over 40 age and different things for, firstly, very, very dry and red skin over age of 40. Any particular type of facial or skincare that you recommend for this age group, and like what the budget is around all of that, and also the best and most natural treatment for wrinkles. So we all want to know more about that.
So you'll have to remind me.
Okay, sorry, yes.
So, general aging over 40?
Yes.
Okay, so we always, I think when we reach milestones, so when we hit 30, we think we're over the hill. When we hit 40, we think we're over the hill. And everything in between, we think we're over the hill. So aging is obviously what's happened to us from birth. So it doesn't just start when you're 30, it doesn't just start when you're 40. So at the end of the day, at 1, your skin cells are 1 year old. At 40, they're 40-year-olds. So they are going to behave differently as we get older. But I would say that age isn't really dictative to everything that happens with skin. So for example, I could be 40 and I've never really abused my skin in the sun. You know, I've been really good at protecting it.
I have.
You know, my skin cells are going to be very different to somebody
Yes.
who's abused their skin, who's, you know, even been on previous medication, they've done different things differently. So age, yes, figuratively, is a number, but again, how that skin behaves at that aging stage is going to be different. So back to the drawing board, that's why skin is bespoke, because everybody's skin is completely different. But aging as a whole, obviously, I always say to people, aging is not in one product or a one serum or a one ingredient. There's a lot of trend around retinol at the minute, and that's fine. Retinol has its place to play if it's used, well, it depends for me on the skin more importantly. So I say to people, you know, don't run after ingredients just because they're trendy, because you will, again, you know, retinol's not for everybody at every stage with every skin condition. You have to be very conscious of who you're putting that onto. But I think your whole concept around aging, I think, needs to be more holistic, in the sense that aging isn't just what you put on the skin. It's, you know, your lifestyle, your diet, your stress, your sleep, your sun, your products, your in-clinic treatments, your supplements. It's all encompassing to how we age. And I don't want to say that to overwhelm people, because it doesn't have to be complicated. But when I talk about skincare and aging, everything you use must be focused on aging. So the very cleanser you condition your skin with, to the moisturiser, to the serum, to the eye cream, all of that should be anti-aging, or certainly, I will say, if you're looking at the health of the skin, if you're actually caring for the actual innate health of the skin, then that is anti-aging. So this is where, you know, people might invest in a really good moisturiser but use a really poor cleanser. Well, that doesn't make sense, because if you're going to invest in a really good moisturiser, then complement it. Don't be stripping your skin barrier with a cheap cleanser.
Yes, yeah.
And I understand, you know, this is where people get hung up on ingredients, because they think, right, well, it doesn't really matter what I wash my face with, but it does. And it doesn't really matter the moisturiser, as long as I get the retinol on, or the vitamin A, or the hyaluronic acid, then it's all done. And it doesn't work like that. So it has to be all encompassing of how we're working that together. And this is where it is so important to see somebody that knows what they're talking about, who can draw you up a treatment plan for your skin at your stage and your age, even from summer to winter, because that's going to look different. And when it comes to budget, like I say to people, you know, professional skincare will cost more, and there's many reasons for that. When I'm talking about professional skincare, I mean skin health focused ingredient, like scientific skincare, not just nice smelling stuff that smells nice and feels nice or is packaged nice, but actual therapeutic skin ingredients. So I will say this, because I'm not here to sell just, but we work with a company, Dermavigils, and there's nothing like it. And I'm going to be completely biased and say that, because I have worked in this industry long enough to see the difference in variations in products and ranges, and this product really is focused on the literally core necessary ingredients of what your skin needs to thrive. Essential fatty acids, ceramides, lipids, all those things that if you haven't heard of, then you're not using skincare. But yeah, so that will cost more, but you could be surprised, it won't cost you as much as you probably think.
No, exactly.
And I think people are fearful of maybe coming to a clinic like ours, because they think, oh, I couldn't afford that. But you can't afford not to find out how much it's going to afford, because I can guarantee you're probably wasting money in other places with your skin. And honestly, I say to people, when you get a really tight, really effective skincare routine, and for some people that's 3 or 4 products, you're not then looking for the next shiny package. you're not standing at the chemist shelf saying, I'll throw that in my basket, it's only a tenner or 15 quid,
Yeah.
and you don't use it and you bin it. So I would argue that it makes more sense to spend more money on key products than buying heaps of cheaper products.
And I would just jump in and say that I'm a testament to that, because before I came here I would have tried this and tried that, and stuff that maybe wasn't really that cheap, but it wasn't really that dear. You know, try something at £20 or try something at £30, and before you know it, you're just constantly trying things that you just don't know if they actually work. Now, and I will hold my hands up and say, I will not let anything else touch my face that if it's not from in here, because I know now from what I've learned from being with you that, you know, something might be marketed as really good, but whenever Victoria's took me through the ingredients and said, well, this isn't doing any good for you, that's not doing any good for you, that's not bad, that's not going to do you any good, that I realised that the products that I'm getting and buying from in here is what is actually going to help my skin in the long run. So I would just not buy anything from anywhere else now, do you know?
I know, and it's like, some people, like, I think TikTok's encouraging this because people are actually, I think, addicted to buying skincare. They are. But I'm like, okay, just buy handbags or buy shoes or buy something, but stop buying skincare, because you're doing it with good intention. So like obviously for anti-aging or whatever that may be, but you actually might be doing the very thing, the opposite of what you're hoping for. And we see this day and daily, and this is where we see such transformations of people's skins when they actually take away what they're doing. Add a simple like cleanser, moisturizer, eye cream, like even as basic as that.
Like I only have what, like 4 or 5 products that I really use. I have an eye cream and the day serum, the night serum, and then my cleanser. Like I don't have loads of different products I need to put on my face, and it is easy. It's
but
not.
If you think of the amount of quality ingredients in there, you don't need. Like one of my biggest kind of things I hate to see is like, you know, somebody doing a like 15-step skincare routine at night.
No, who has time for that?
Yes, that's where you won't have enough budget long term, and number one, not enough time, and there's no way you're going to be consistent with that. I would rather clients had 3 to 4 staple products and were consistently using them, and that's where to me the magic happens with skincare. So, and yes, I have a lot of products at home, and we call it like the wardrobe products. So like from what I would do on a dry day, or like winter and summer is different. So yes, there's certain times of year you can have more products or do different things, but I'm not using all of those products every single day. So yeah, it can be totally tailored around you and your skin, but also your budget as well.
And then I've heard you saying this before about, you know, like maybe it's outside of your budget to keep coming in and getting your treatments, so you could still be kind of part of the clinic and come in and get your regular cleanser and your moisturizer. Just because you can't maybe afford to have all the big fancy treatments, you could at least, when you're coming in and you're getting the proper cleanser and the proper lotion that's going to help your skin, you know, you'd rather even people were doing that.
Well, even with skincare, so people, again, you know, when we're writing a treatment plan, we're going to recommend the products and the treatments that's most suitable for the outcome that you want. So again, for the outcome you want, not what we want. So if a client obviously is at a stage in life and they do need clinical treatments, like products can do amazing things. Like, you know, really good skincare has really good potential, but there comes a stage where the topicals isn't going to be enough. For example, like we could never do with our hands with what microneedling can do. You know, we can't release growth factors with our hands. So there's a time when the treatments, to some degree, if that's the result you want, is essential. So, but you don't have to make them forever. Like we have clients who come in and do a treatment program, and then they might do microneedling every few months after they've had that. Our skin health treatments are kind of like our core concept treatment, where we customise and make those bespoke every time. That's our most regular kind of, our clients would do those 4 weeks, 6 weeks, 8 weeks, whatever that routine is for the client. So again, this is where we will sit down and discuss all of that and explain to you maybe how that, you know, is unique to you and how you can do that. So my attitude is I'd rather use skincare every day than trying to just rely on a treatment, you know, once every while, because your money's going to be better spent in your products then if that's something you can commit to on a more regular basis. But of course the treatments are amazing, and they are delivering. I mean, the treatments are going to get to deliver the results that you can't do with skincare. I mean, you can't remove facial veins with a product. You can't remove pigmentation alone with a product. Well, certainly in what the way we're looking at it with IPL and things, you know, microneedling is amazing, but again, those may be treatments you're not going to start with anyway, because they're more advanced treatments, and if you've not been used to anything like that, we're not going to start with those. But there's so many options.
Yes. And I suppose that the fact is it's tailored to you, your budget, what you want, your results, and you're never going to walk in here and think, oh my goodness, I now have to pay all of this. Like Victoria will sit down and kind of work out treatment and budget with you, so that you never feel like you're maybe in over your head kind of thing as well.
My attitude is just like book a consultation, and then you can ask us all of those questions. You know where you're starting from, and I would say you should walk out of that consultation more informed about your skin than you've ever been. And even if a client never walks back in here, as long as I've really helped them to understand what they need and also what they don't need, that's equally as important sometimes. Then that's a job well done, and you should go away with making better decisions regardless of that. So,
I know, and that's one thing I always appreciate with you. I always thought, well, you'll never just try to give me this, this, and this, and this. It's a nice personal approach. You're never just going to upsell something.
Yeah, I think again sometimes we get clients in and they're like, well, I'm using this and I'm using this, and they'll probably bring their products with them or they'll take photographs, and I'm like, so what are you using that for? What are you using this for? No idea. Like, haven't a clue. I just think that will be my detriment if anybody ever walks out of this clinic not knowing why they've got a product, why they're using it, and what benefit it is to their skin. So I have heaps of products come in, and it's just, skincare is trendy now. So like a few years ago it was niacinamide was popular, and then it's hyaluronic acid, now it's retinol, now it's vitamin A, whatever. And all of these things are good at the right time, at the right need of your skin, but most people have no idea why they're using any of them, and that kills me.
Yeah, you're so right. I think we should put a wee vote button on here to say who all is using something they don't know why they're using it. So we'll move on. I think we've probably covered all of that. That's all about the aging skin, the wrinkles. I suppose that's all covered in or do you want to add anything else to like wrinkles and specific?
Maybe wrinkles. So obviously with wrinkles, that's probably where we assess people's age by, is how wrinkled their skin is. Aging for me is more than just wrinkles. So I will say, yes, you've got the wrinkles, which is the texture of the skin, the colour and tone of the skin is just as important, and the clarity of the skin as well. So you can have a smooth skin with no wrinkles, but it's really like dull and sallow and not bright. I mean, that dictates age as well, and obviously then with the pigmentation. So the colour and tone of the skin really will dictate that aging stage of the skin as well. So with wrinkles specifically, again, it's not just your one wonder product or one hero product or one hero treatment. It's again a multitude of what you're doing every day to your skin. And at the end of the day, wrinkles, we've all got them. There is anti-wrinkle treatments out there, and if you want zero movement and you want zero wrinkles, it's really impossible to have zero wrinkles, but zero movement in that area, then that might be an option you try. Some people just don't want that. Some people, that's not their forte, and that's, I would say to clients, it's not something we offer, and it's not that we're totally against it, but I think what people need to realise is that anti-wrinkle treatments don't fix skin. So yes, they'll inhibit movement, and they'll, if you like, stop the wrinkle, but what about the skin? What about the texture, the hydration, the glow we all look? We can't do any of that. So again, that's where you need help to understand your skin better in general, because if you're just focused on wrinkles, you're never going to be satisfied. And a lot of the time when we do maybe fix that wrinkled area, then we'll realise we've highlighted somewhere else that needs help. So it can be a little bit of a rabbit hole to get down into. Everything has its place if that's what you want, but again, we would help you to understand that better. And I suppose it depends on the clients too.
That might lead on. I heard you mention earlier the LED that we have. So I know that after a lot of the treatments, you'll do the LED light, and then you have your own, the light, the Omnilux that I have as well now at home. So even just a wee bit about what that does, for aging too, because I know that if I've had a good few questions from people who are maybe interested in getting one. So what that does even too.
Yeah. So LED's been about a long time. Again, when we opened our clinic 7 years ago, nobody had heard of LED. We shipped our original one in from California, which is hilarious because nobody had any idea what LED was. So we used Soluma clinically in our clinic, and like I said, we used it for 7 years. So LED is non-UV wavelength, so it's like a therapeutic, just think of like light, but it's specific wavelengths. It's not just a colour, it's specific wavelengths that are going to stimulate different kind of things in the skin. So you have your blue light, which is more antibacterial, if you like. It's more for acne, it's more helping to kill off the acne bacteria. And then we have our red light and our near infrared. So there's different types of light. So we're not going to give you a science lesson because that's too complicated.
Yeah.
But light has a therapeutic effect on skin. Well, clinically proven ones are anyway. So any LED that we use in our clinic is both FDA and CE medically approved LED. So really important that that's where you're starting with an LED. And I say that because there's so many like devices now in the market that aren't approved. And light is so vulnerable, so if it's not safe, you could be in the UV spectrum, and that could be a whole other issue. So again, with LED, I want to say that just because I don't want people getting confused.
Yes.
It's not just light, because if it was that case, we could all just wrap Christmas tree lights around our head, but that doesn't work. So
you could be doing more harm than good. You could actually be doing the opposite if you aren't.
Yes, or it could do very little, or it could do harm, especially with the blue lights. We have to be very careful that they're not in the UV spectrum. So, but when it is done right, it's amazing. So the red light specifically for anti-aging will help to upregulate. So I explain it to people just in really simple terms. Recharge the batteries. That ATP energy in the skin cells would basically help cell the fibroblast and all of that. So basically it's re-energizing tissue. And as we know, as we get older, the cells just don't kick the same. They just don't have the same power. So anything we can do to upregulate those, and they're going to perform as healthier skin cells, which is going to lead to a healthier skin. So I always say to people, obviously in our treatments and our bespoke treatments and after some of our more advanced treatments, we do include LED because there's so many benefits. But from a home care point of view, with LED specifically, we brought in the Omnilux home devices it's actually over a year ago, and I waited to make sure we could get one that was both FDA and CE medically approved because, like I say, I'm so fussy. And Omnilux have been a provider of professional LED in the professional industry for like 20 plus years, so they know what they're doing. But if you want anything else at home more than skincare, then it's an LED you're looking for, because it is proven and it's getting, again, deeper than what our products can get to, and it's helping the cells behave better, which is going to help your skin respond to skincare better. So it's kind of that multi-layered approach again.
Yeah.
But if you want to invest in anything, then it has to be a home LED, and you have them for years. They're not disposable. You're not chucking them in the bin.
Yeah. Or they don't expire, or they don't wear off, or like some treatments, you know.
Yeah, like it's something you're going to have for years and years. So a really good investment.
And even just when you use it, like you do sort of notice you're like less puffy, or like, you know, you sort of like that plump without being like puffy. You know, the nice.
So again, there's two different types. It depends, but we're talking aging here. Then it's the Omnilux contour you're looking. But even with pore structures, so like again, people are worried about open dilated pores. Again, that can be linked to collagen depletion. So the red light helps to bring back more collagen to skin, which is going to tighten pores. So it's not going to give you a facelift at the end of the day, but if it can help, what you're trying to do is keep your skin as good as you can for as long as you can. And LED is one of the things that's going to do that, and it's going to help to just upregulate everything. So there's nothing I say that LED can't help, really. It helps so many different things, even peroneal dermatitis, like, you know, acne. It helps so many different things, so it's such a good tool to have.
Yeah.